We're here with Dr. Nimmi Kapoor with Breastlink. Thanks for being here, Dr. Kapoor.
My pleasure.
Well, tell us about Breastlink. How is it unique in the management of breast disorders?
I'm really happy to be a part of Breastlink, and it's because we have a big team together. We're always together. We have our radiologists next door, surgeons, and then we have our medical oncology, all under one roof. So we all share ideas. We talk about patients together. We come up with plans together. So it's a wonderful system.
And it seems like so much is changing with breast cancer and, how the patient, can just have an easier time of going through it. What is evolving in the surgeries for breast cancer patients?
There's so much happening, and we try to do less surgery, actually, and make it better for patients, better cosmetically, better from a cancer perspective. We do oncoplastics procedures with our plastic surgeon. We do nipple-sparing mastectomies and really preserve the shape and the volume of the breast as much as possible, whenever possible.
So women today might not have a huge scar right over their breast. Is it something where you can hide the scars or the incisions?
Absolutely. We do our best and we try our hardest. That's sort of our job as surgeons in this field, to minimize scars and really make things as natural as possible.
And how involved are you in research studies or the Breastlink doctors? Are you involved in research studies? Are there things that that could make, the surgeries better and you kind of institute those research studies?
Yeah, this was actually the reason why I joined Breastlink, was because of the research that this organization is dedicated to promoting and being a part of. We have a huge research group. So every week at our tumor board conferences, we present our patient cases, and if any patient qualifies for a study, they get enrolled. And there's a whole research group that caters the patient and carries them through the research process. It's a great opportunity for enrolling in trials that patients wouldn't have otherwise have access to. So I'm really proud to be a part of that.
Well, let's talk. There's a lot of legislation going surrounding breast density. Why do breast dens make it harder to? Does it make it harder to operate on them as well?
That's important. That's a tough question. So, dense breasts are, as our radiologist Dr. Chen will talk about, are difficult to view mammographically, and so we know that cancers can hide in them. We know it's harder to actually see these cancers on a mammogram. We also know that dense breasts themselves are more likely to develop cancer. So it's important for patients to know about their higher risk, perhaps, and for radiologists and surgeons to understand the decreased sensitivity of imaging. So it's a very important topic.
And what do you see as the future? Where do you see breast cancer surgery going, or just the treatment in general?
It's more and more we see that breast cancer treatment is becoming individualized and patient-centric. So it's not just one treatment for everybody. It's really individualized. We see really the world of genomics taking over for breast cancer care. Patients are getting individualized treatment just for their cancer, not for everyone's cancer, but for what kind of cancer they have. So we are understanding cancer at a much higher, more advanced level than ever before. So I think cancer treatment is really going to become personalized, and we see that happening now already with the advanced genetic testing we have for individual tumors. And that's very exciting to me. It means that not every treatment is going to be right for everybody, but we can figure out what treatment's going to be right for you and for you and for you. And you might have what looks like the same cancer, but a completely different genetic type of cancer. So we really know how to attack cancers differently and how to really treat people individually. And I'm very excited to be a part of this area.
Well, what do you do to kind of get away from it all? How do you relax? I read an article where you go running. Is that something that is still a big part of your life?
Yeah, it's kind of critical to actually have that side of your life and a balance in your life. I have this beautiful 5-year-old that keeps me going, and I travel a lot. I enjoy traveling, and running and staying fit and being active is also extremely important. So,
and how do you balance all of this with being a doctor and kind of always being on the forefront of research, but then also having a 5-year-old that probably slows you down to some extent, even though you're probably running after her?
Balance is tricky, and I'm really fortunate to have a very supportive family, fiance, and life, and it's important to have balance.
And is it easier with the way that Breastlink is set up with all of the doctors being in-house? Does it make it easier and more efficient to take care of more patients?
I mean, I can't imagine any other way of practicing. We have it good. We're very lucky to have our radiologist right next door and our oncologist in the next office. So on basically every day I see patients, I go to my radiologist and say, can you help me figure out this image? And every day our oncologists are talking with us about, well, this patient may be a good candidate for this trial or this drug, and can you send her to me now so we can talk? And I think it's the best thing for patients. I mean, regularly we are crossing over and saying, hey, can you come and see this? And I think it's the best thing for patients. They have that immediate care and attention right away.
Well, it sounds like the logical way of doing things, but why is it so unique?
Well, you know, in bigger centers, that's a good question. It shouldn't be unique. It should be the way it is everywhere. In bigger centers, it's a little harder. There's more distance between people. There's more driving to be done. There's more wait times to be done to reach the radiologist, to reach the oncologist, to have that direct interaction right away. It's not always set up that way, but I think our goal is to make sure that every Breastlink center is like this, and that this is the way breast cancer should be managed and treated.
And I'm sure the patients appreciate it, just being able to go to one place
and
know that they will be well taken care of and that people will know what's going on with them.
I mean, I actually I recommend my patients to go elsewhere and get second opinions, and they almost always say, no, we want to stay here. We like that everything is here.
Yeah.
Patients love this, and I think it's a real big benefit for them.
Well, to get more information on Dr. Kapoor, you can go to breastlink.com.